Good evening. My name is Dennis Perez, and I'm interviewing for a sales territory manager's position with Azura Vascular Care. My name is Dennis Perez, and I've been PCT for over 14 years with Fresenius Medical Care. I am also a graduate nurse, and I've done about 11 years in hospital setting and about 3 to 4 years in clinic setting, taking care of dialysis patients. So I'm very well versed when it comes to the patients and their need for dialysis and their accesses. And Zuro Medical Care seems to have a very well versed team to be able to have very quick turnarounds with dialysis patients, from same day vascular access care to next day, depending on how busy they are. And it's very small as far as group wise. So the nurse to patient ratio is very small, which is great because you always want to have very good care, and knowing that the nurse is there one-on-one with you is always going to be a plus, no matter where you are. That they're always going to be there with you every step of the way. And they have an amazing physicians and surgeons that are there as well, because it's just a group of just very talented individuals that know exactly what they need to do, and how to take care of the patients with the highest possible quality outcome, to make sure that you have your best interest at heart when it comes to your life and your treatments and any kind of surgery that needs to be done. And they are very well versed as far as whether it needs to be an AV fistula, an AV graft, a CVC, a peritoneal dialysis catheter. All those can be taken care of at this facility. And although most people are used to having to go to a hospital setting to be able to have these done, hospital settings sometimes can take a couple days to make sure that you get your vascular access taken care of. Whereas with Azura Vascular, they can have it done same day or next day with an appointment. So it's very easy process. Not to mention the care that you will receive when you go to Azura Vascular, because the team seems like they're just the best of the best when it comes to this field, and they are going to treat you in the highest possible quality that they can, to make sure that you have a very easy process from admitting to pre-op, post-op, and being sent home the same day within a couple hours. For dialysis patients, it's very important to have a proper working access that's patent, because that is their lifeline. Dialysis patients who do not get dialysis, they obviously will become nephrotoxic. They will, become fluid overloaded, and then they'll get really sick. That's why it's always important to have the access working in optimal state at all times. That way, when patients go to their access centers, they're always having the best care, and having the most amount of toxins removed from the blood every single time they're in dialysis. And that can only be achieved with proper access care. So whether it be stenosis or maybe fibrin sheaths in the catheter that need to be addressed, this is something that can be dealt with at Azura Vascular Care. And with the quick turnaround, it will allow you to not have to spend a few days in the hospital. You can resume your treatments back at your clinic within the day, and you'll be back on your feet and in no time being able to go home after the procedure. As stated before, my name is Dennis Perez, and I have been working in both the acute and chronic setting for over about 14 years. And I have seen both sides and the importance of not allowing the patient to reach the point where they need to be hospitalized because their access is not working. A lot of times they could have pulmonary edema, they could have anasarca. They could have shortness of breath, where to the point where maybe they need to be intubated or be put on a BiPAP machine because they just can't breathe. And these conditions can be avoided with proper care of the vascular access and having quick turnaround for you to be able to meet your goals when you go to your treatment. I believe I would be a good fit for this company as a sales territory manager due to my background in both clinic and acute settings. The fact that I'm a graduate nurse would be a bonus just because it would be very simple for me to explain the procedures. It's not foreign to me. I did go to nursing school for this, so I'm very well aware of surgical procedures and the importance of proper care and patent accesses for patients, especially since I have so much experience in the dialysis field, that it just makes it so that I could become the patient's advocate and be able to provide a service for the patients that some would say need the help or guidance as far as what they need to do to get back to their daily routine and their lives. I believe I would be a good fit because I am an overachiever. I am slightly OCD, so I do like to be organized. And due to my background of being both hospital and clinic, that I would be very well versed in the lingo and the customs, being able to speak to doctors and nurses and technical staff in the ways on how to improve patient care and the benefits of going to, say, Azura Vascular compared to going to the hospital, where sometimes the wait time can be 3, 4, 5 days, depending on operating room times, surgeon times, and having quick turnarounds will benefit the patient in the long run. I feel that with dialysis patients, time is always, necessity when it comes to their treatments, because they do need it. Unlike patients who are not sick, that, our kidneys are working 24 hours a day, theirs are only working 3.5 hours every other day. So having the access working at all times is always key to ensuring that the patient is safe and healthy when they're getting their treatments. I do appreciate the consideration for this position, and I look forward to working with you guys, and I feel it's going to be a great adventure and a great learning experience for me. And thank you so much.